as you can see, the trichiasis is the condition which is misdirected eyelases, like this, as you can see. See, it should go outward, it goes inwards and causes irritation. Okay. Entropion is the condition where the, as you see, this, the inverted eyelids are eyelashes and eyelid both. Once the eyelid goes inwards, the eyelashes will also move inwards and touches to the cornea and the sclera and causes irritation. So it also is plucked. It should be removed. Okay. The eyelashes should be removed, which is causing trouble. Here also it should be removed. This one is the trichiasis. Okay. Which is the misdirected eyelashes. And this one, as you see, this one is the inverted eyelid. And once eyelid invert, the eyelashes also will invert and causes trouble to the cornea. Here, this one. Okay. And this is the, this one is the drooping of the eyelid, ptosis, because of the paralysis or weakness of the molar muscle. Okay. So this is what is about some of the clinical aspect. Now about some of the clinical aspect of the gland. This will be covered by 110% by clinician. I know very well. Stye, because it's one of the common condition of the eyelid. So it will be covered. Whosoever takes your classes for the ophthalmology will cover this item. Okay. So this one is the, I'm just giving you idea that when it's the acute infection, we call it stye. And when it is chronic infection, we call it chalazion. Chalazion. So chalazion is chronic infection. And mostly it is for the meibomian gland. Now you know what is the meibomian. It's a sebaceous gland. So it's a meibomian gland and its chronic infection is known as chalazion. As you can see, the redness is not so much so predominant here. It will be explained by a clinician, but I'm just explaining that this is how it looks like. But once the redness takes place here, this one, clear, it is the redness like this one, both is acute conditions. If it is for the meibomian gland, we call it internal hordeolum, internal stye, because meibomian gland is inside. And if it is at the margin of the eyelid, you see exactly near the margin here, this one, this one. So that one is the external hordeolum and it is by the glands of Zeiss and the mole. Glands of the Zeiss and the moles. So this is what is here. Okay, that is external hordeolum. It is also known as stye. This one is, you see elevation red, but when you evert, you find redness more there and some infection of the gland seen predominantly, whichever is the gland involved, the mouth of the duct may be blocked. So that is what is the meibomian gland infection. And it is also known as stye, but it is internal hordeolum, clinical term. The layman term is stye. When it repeatedly occurs and it is long time, then it is known as chalazion. It's a chronic infection. So these are some of the clinical aspects of the eyelid, as I explained to you just for your reference, and clinician may explain to you.